Hi everyone. I'm putting out this video for a number of reasons. The first is to both thank you and provide assurance that as a health board we are doing everything in our power to rise to the challenges that we are all facing right now. I know many people will be feeling worried and anxious about what's happening, and of course I share that personally. These are very unprecedented times, but I wanted you to know that the health board is there with you every step of the way. We're making plans, we're enacting those plans to keep everybody safe in the challenging times ahead. I also wanted to let you know that following a recent holiday, I tested positive for the virus myself 2 weeks ago. I was lucky in that my symptoms were quite mild, and I was over it in about a week. But I have to say it was a huge shock to get that diagnosis, and not something that I expected at all. But as I say, I was lucky, I came through. Most of us will have these sort of mild symptoms, but of course those with more vulnerabilities, underlying conditions, those are the people we need to protect. So I've been self-isolating for the last 2 weeks, and this is my first day back in the office. I've also had an opportunity over the last few days and in person this week, rather than via Skype as I was last week, to review all of our plans. There is a huge amount of planning work going on across the organisation, and thank you so much to everybody who's been part of that. We are now starting to enact those plans, and you may well see changes to our services, changes to arrangements within hospitals, even temporary buildings being established so that we can rise to the challenge ahead. We will keep you posted as far as we can on all of those changes that they're happening in a very fast-moving environment, but expect to see those on the ground shortly. And of course, each of our hospitals has been doing their own individual plans and establishing designated areas as we start to see patients who have tested positive for the virus coming into our services. And I will be out and about talking to the hospital managers and hopefully seeing many of you out there and looking at our plans on each of those hospital sites in the next few days. So please stop me if you see me in the corridor, if you have any questions or you just want to let me know anything. It'll be great to see you all. I also know that as a board, we've been working very hard to ensure that we are supporting everyone through this. I just wanted to say personally, we are there with you. We are very much looking to support the front line and ensuring that you all have what you need as we start to face some of the challenges ahead. And for the public who may be watching this, and of course for yourselves as members of staff, please ensure that you look after yourselves, that you follow the advice around self-isolation and dealing with symptoms and so on. It's important for all of us to play our part in this, and I know you will all endeavour to do that. So thank you. Thank you for everything you're doing. I will see many of our staff hopefully very soon. Thank you.